You are listening to Radio Maria Canada. We now present the Health Hub, hosted by Kathy Biasi.
Welcome to the Health Hub on Radio Maria Canada, exploring cutting-edge health and wellness information and therapies, helping you to take your health to the next level. I am your host, Kathy Biasi, and I'm a holistic nutritionist and a professional cancer coach. Today on the Health Hub, we are taking a deep dive into the topic of functional medicine with our guest, Paul Burgess. We are covering topics and discussing the significance of a detailed intake form, why proper testing is important for navigating a health journey, and why online searches fall short in solving our health issues. Paul Burgess is the founder of the global telehealth practice, Paul Burgess Functional Medicine Ltd, and the owner of Paul Burgess Wellness. With over 2 decades of experience in treating patients, he realized that what people really need nowadays is certainty that the choices they make about their health are the right ones for them. With so much conflicting information on the internet today, it is impossible to know what is actually relevant and what is just hype. Paul started the Paul Burgess Show in 2014. He is the author of 2 books and is the creator of the 3x5 diet plan. Paul has a goal for each of his patients to live a healthy, happy, fulfilling life. Stay tuned. We will be back in just a few minutes to start our conversation with Paul.
You are listening to Radio Maria Canada. We now continue with the program, The Health Hub, hosted by Kathy Biasi.
Welcome back, everybody. Today's show has been recorded, so no opportunity for calling in. Please do follow us on our social sites. We are on Instagram, Twitter, and Facebook, and we are at the Health Hub RMC on those locations. Paul, welcome to the show.
Thanks for having me.
Tell us about yourself. Let's start out wide and narrow in.
Well, my interest in health came from a very young age, and it was a weird one, really. In the 60s, when I was growing up in London, we'd just come out of kind of the war, and the 50s and the 60s it started to be this era. But the parents of that era was still kind of very old-fashioned. So it was a very relatively strict upbringing. It doesn't mean it was difficult per se, but there's very little emotion involved. And I kind of somehow subconsciously figured out that for me to receive value, I need to be as healthy as possible, and health and athleticism and that kind of stuff kind of resonated with me from a young age. Not that I was any good at it, but it kind of was the thing that interested me. And then fast forward kind of 57 years now. It's been ever since I was 15 and started being able to go to a gym and train and so on and so forth. It's kind of been part of my life since then. And then came a point in my life where I decided, look, this is my passion. I no longer want to be in an industry where I was making a lot of financial gain, which was in investment, an investment company. We set up the largest investment company in the City of London, but it didn't give me any kind of reward. Personally, it was very stressful. In fact, it was probably the most unhealthy thing you could do. And then I transitioned into being a functional medicine practitioner for the last few decades, which has been the most incredible journey, and I love it. It's the most rewarding and just never-ending passion that is amazing every day.
What do you mean by a functional medicine practitioner? Are you a naturopath? Are you an MD?
So functional medicine practitioners is kind of a catch-all phrase for people who generally qualify. I qualified as a clinical nutritionist initially, many, many years ago. And from there, you expand your knowledge and your approach so that you're not just doing nutrition, you're looking at root causes of people's long-term health issues. You're looking at behavioral problems and belief systems. You're looking at how you create a life of just amazement and joy every day for your patients, rather than one that is very much around suffering and pain and illness and lack of. You kind of take care of all of that so that they have the capacity to enjoy life again. And so from a functional medicine perspective, it's about not treating the symptom, which, by the way, a lot of naturopaths or other practitioners will do. I've got nothing against naturopaths, by the way. But, okay, so you're inflamed, we'll give you an anti-inflammatory herb. You're still treating the symptom. It's not the same as giving a pharmaceutical that's anti-inflammatory. And people that, there's a very significant differentiation between treating a symptom and then looking at what's the root cause that's causing that inflammation. And it won't be one cause, just for a spoiler. It's going to be several causes that have come together over many years and that have now led to this symptom. And so it's about getting in, understanding why those things have occurred, what behavioral issues that people have had, the beliefs behind those behaviors, a whole range of things. And then obviously if there's bacterial infections or pathogens or other physical things that need to be addressed, like toxicity or mold and things like that, you want to get in and address that. But it's a much bigger, comprehensive approach to overall health, which then leads to better quality of life and longevity, rather than go, okay, let's treat your symptom so that you can get over this next thing. But if you stop taking that medication that's treating that symptom, statins, for example, are a good one. If you stop taking that cholesterol lowering medication, the cholesterol is going to go back up again. So you have to take this for life. And it doesn't cure anything. It just keeps your numbers artificially depressed. The issue with that is whatever caused the cholesterol to rise in the first place is still going on, which is why the all-cause mortality rate of people on statins is higher than people that don't take statins. So in other words, your death rate is much higher at a younger age if you're taking prescribed dose statins than if you don't take them, because the underlying cause, the root cause that's causing the increase in the cholesterol is still going on. It's still causing problems, and the heart disease and everything else, cancer, diabetes, whatever it is, will still come about potentially. So knowing what the root cause is, treating it so that you don't have to take supplementation or medication and things going forward is kind of the goal for the practice.
So as a functional medicine practitioner, do you believe in, well, there are two things that pop into my mind when I think of a functional integrative practitioner. And number one is the intake. You go to a medical doctor and you've got maybe 10 minutes of allotted time. You go to a functional medicine practitioner and the intake is extremely more involved. What to you is the importance for you as a practitioner? What do you feel is the most important piece of that intake form, and why you value it so much?
Well, firstly, you're absolutely right. When you go to a doctor, they've got a very short period of time because they've got so many patients.
Mm-hmm.
For me, your initial chat, the free consult, the initial one, which says it's 30 minutes, but actually it normally runs to over an hour. That's where you get to know what's going on in the life of that patient currently. And then you get to be able to discuss maybe some of the things that happened historically that could have led to where they are. You want to know about their childhood. You really want to know about what was the health of the mother pre-conception. I know a lot of people don't know what their mother's health was like before they got pregnant, but that's kind of a quite important thing for a lot of people, because obviously the health of the mother will relate to how the baby is born, whether it's cesarean or natural, or whether or not there's anything passed on, like did the mum live in a damp house where there's mold, or were they living near a farm that was sprayed with pesticides? And if the mum had high levels of toxicity, then you can bet they passed it on to the baby. So was the baby a bit of an ADHD or overstimulated kind of childhood? Were they hard to calm down? Were they hard to manage because they just didn't stop crying as a very small child? And then when they're older, they kind of bouncing off the walls and all this sort of stuff, because a lot of that would have been passed on from the mother. So knowing those things can be very useful. But that's just the initial kind of chat, if you like. Then the intake form that I use tells us a lot about the history. Again, what vaccinations, when, other traumas in the life, other key stages. What was it like when you went to school, when you went to college? What was your mental health like? Have you ever considered things like suicide? Have you ever been depressed? Have you ever felt though life has no joy? That kind of thing. And so getting a very comprehensive history really builds up a very good picture as to what could have contributed to some of the current symptoms. And now you asked a really good question, is like, which part do you like the most? Actually, every person is different. So there's not one piece that says, oh yeah, as long as you answer this question, that'll be the best thing we can do, because it's always a combination of things. And different combinations bring out different permutations. So one person, it can be half a dozen different questions that they've answered in a certain way that gives us a really good clue as to what's going on. And then the other person, it might be 2 or 3 that are very significant things that happen in their life that we can see after those things, these elements started to go wrong, or symptoms start to present themselves, whatever it is. So it's really difficult to say, oh, this is my favorite part. What I do love about it is we get a very good comprehensive understanding of their whole underlying system and why things might be the way they are. And I spoke with a doctor recently. It was an interesting conversation. She's a lovely woman. She happened to be at a clinic I was visiting. Somebody invited me to go there and talk and do some stuff and whatnot. And this doctor was there who was just fascinated by the whole subject. And there's a school of thought that says if you have acid reflux, it's very often a sign that your stomach acid is too low. And instead of taking a proton pump inhibitor or something to deal with your stomach acid to stop the burning, you would take something to stimulate more stomach acid and then look at why is it low in the first place. And that was a revelation to her. And she said the antacids, if you like, I think in the US it's things like Tums or Pepto-Bismol, that kind of thing. The pills that they give from the doctor, that's her largest prescription that she gives out. She does more of those than anything else. And it really baffled her. And she struggled a lot with trying to come to terms with the fact that what she's been doing for so many years may not have been right, or may not have been accurate, or there's another viewpoint to think about.
Mm-hmm.
And then she brought up the subject of, and I'm getting slightly off topic here, but she brought up the subject of HRT and hormone replacement therapy. And so I've kind of been quite active in that area for many years, and I kind of understand it pretty well. And I've interviewed many, for want of a better expression, specialists in hormone replacement therapy all over the world. And the question I ask them is, when you administer hormones, you measure it in the blood to see what the levels are, to see if you've got the levels right. And they'll go, yeah, you have to do that. So we know we've got the right thing. Right, great. And then the next question is, do you measure where those hormones go? Because the downstream effect, for example, of estrogen can be very destructive if it goes down the wrong pathway. And it has three main pathways it goes down. This is very simplified. But one of them can cause DNA damage and potentially cancer and that kind of thing. So if you measure where it goes and it does go down that pathway predominantly, you can figure out why it's going down that pathway. It could be that a lack of certain cofactors, certain antioxidants needed. And when you supplement with that, you can bump it down a more beneficial pathway.
Mm-hmm.
And so you ask them this question, they go, I said that to the doctor, sorry, on that the other day, and she just looked in complete bewilderment and just said, "Can you do that?" It wasn't even a thing she was aware of, and we kind of get caught in this environment that we forget how much knowledge we have and how advanced we are in certain circumstances, and then you say something that you think is really basic, and a very experienced general practitioner doesn't even know that the concept exists. And so there's no way that they can, in 10 minutes, discern what's wrong with somebody, understand what a root cause is, strategize how to treat that root cause, and then look at all the other areas that we said, like beliefs and that kind of thing. And so for me, I would say it's probably an hour to 2 hours of historic data collection to bring someone to where they are. And that doesn't include the testing that we would then do, looking at bloods, looking at toxicity tests, viral, bacterial load, that kind of thing, which gives us a very clear picture as to where they are today in their health. And then we've got a real understanding of what we need treating.
When it comes to, so we've not really ever on this show spoken about the importance of the intake form. I've been in integrative care we're approaching 10 years now almost.
Yeah.
And when I first started, I was really excited, of the intake form and individuality. And we were going to be so, our group is so different from that group who doesn't spend time with people. And here is what I have seen over the years. I don't know if you're of the same bent, but even us as integrative practitioners can pigeonhole our method of practice and the way we work with people. And that's because of the knowledge base. If you're a nutritionist, that's going to be your comfort zone. Absolutely fine. So it's important for you to, research who you want to work with. But where I want to kind of put the bow on this before we end off the half is that the intake form really can be a director for the practitioner, but also for the person who is the client or the patient of the practitioner, because it is mind-numbing the amount of facts that can come from a very, very good intake form. And when we're talking about having people educated on their own health, to me, it starts with this form. Does that make sense to you?
Yeah, absolutely. And also, you're right. If you're not careful, you can get stuck in a kind of repetitive, treating people the same kind of thing. But I totally agree with your point that when they are filling out that form, and you will definitely have got this, because I get it from patients when I discuss the form with them. They're trying to say, do you know what? There are a few questions there I really had to think about. But it's very interesting, isn't it? And like you said, it's got them thinking about their own state and health and approach and beliefs in a way that they never really considered before. And that's a really good first step, because it allows us then to take them on from there to a pathway that they are intrigued about and are and are happy to come down, because they've already started to. Basically, it comes down to questioning your current beliefs around what you think is right. And once they start being a bit more introspective, it's amazing the changes that they make at the very beginning even.
Absolutely. And this intake form to me is the first step of people becoming a part of their own healing path.
So that's the first thing. Yeah. That's the first time they take some sort of interest and responsibility in, they are the ones that need to make the change. You're absolutely right.
And to me, if you can move health in the right direction as a practitioner, but if you can equip people with the questions and the different pathways that they can look towards health answers, then you as a practitioner have been successful with the person that you're working with. So as I said, we've never really talked about the importance of an intake form. Do you use an intake form? I mean, there are questions that most integrative practitioners ask, but do you even feel that your own intake form can have a bent towards the way you like to practice?
No.
No. Okay.
No, I'll tell you why. So the intake form that we have is very automated. Very much modern technology, where we get people to answer certain questions. They have to write quite long descriptions. And then there's quite a large section that is tick box. So do you experience these symptoms? Have you ever had these feelings? Do you ever consider those things? And it's kind of a tick box environment. And between the two, the written and the tick box, we have an AI that allows us to really extrapolate a lot of data from that form that tells us, actually look at, doing an organic acid test for this person because the neurotransmitters are showing up as XYZ, or, there's a potentially a liver issue being caused by a selenium problem or whatever it is. And it gives us a lot of understanding of the current situation from the health perspective, and also what could have been happening historically. But the key point then is you take that data and discuss it and interpret it again with the patient to really hone into what the really important things are, and have this two-way discussion with them around, firstly, what's most important to them about their health, and figuring out what's really most important. Not the thing, I want more energy and I want to be more confident and I want to avoid Alzheimer's, because that's not the most important thing. When you really drill down, you find that people are looking to do these things because it's the only way that they have value, and they want to be valuable to their children, or they want to show the world that they're not lacking in purpose and value in life. It's not the first thing they say. You have to drill right into it. Mm-hmm. But with the two things combined, it's a very powerful place to start, as you said. And then for us, I'll deal with a patient for 12 months. Like literally, we'll be in their life for 12 months, treating them in all sorts of different areas, adjusting dosages, approaches, getting their sleep right, managing their stress, making sure that their pots and pans are the right ones, removing toxins from the body, optimizing their hormones. It's a very complex piece of work.
And you can tell the person who has been working with an integrative practitioner. I mean, it is evident in the things like the pots and the pans and the plants that they have in the house. It's a beautiful thing to watch unfold. And I think the importance of this intake form, it's actually not even what we were going to talk about this first half, but it's such an important piece. It's such an important piece to speak about that,
I love to, I think you're so right.
It deserved that space. We're going to take a quick break, and when we come back, we are going to talk about testing and how the approach in your method of practice is. So everybody, we will be back in just a few minutes.
You are listening to The Health Hub here on Radio Maria Canada, a Catholic voice wherever you are. To contact us and be a part of the show, email thh@radiomaria.ca. We now continue with the program. Here once again is your host, Kathy Biasi.
Welcome back to the Health Hub. We're going to start off the second half with Paul talking about something you brought up a few times in the first half, and that's testing. Here in Canada, it's not as prevalent, I would venture to guess, as it is in the States and then the UK. But tell me why you feel testing is so important to get the real landscape of a person's health.
Yeah, I mean, you're right. Canada is really tough. They've got some interesting hoops to jump through before you can get a test done. Majority of the rest of the world, we've got patients in near enough every continent now. We can get testing done relatively easily. And in the US, certainly, we do a lot of tests. And the reason I work with those, because a lot of people say, "Oh, you shouldn't treat the test. It's not the be all and end all." And absolutely right, it's not the be all and end all. But if you're trying to get somebody better who's been chronically ill for 10 years, debilitated, hasn't really been holding down a job, can't look after their family, you probably need to do some testing to see what else is going on. And the tests that I favour a very comprehensive blood test that we do initially. And the blood test I use has a report that looks at the optimal ranges and obviously the doctor's ranges, which are two different things. The doctor's range is very wide. The optimal range is much narrower. And we can
you know what, Paul?
Yeah.
Right there, a lot of people might not understand what the difference is. So maybe let's just stop there and tell them what the big difference is there.
Sure. So the regular doctor's range is something you'll get at most doctors. People go to the doctor, they don't feel well. The doctor says, "Let's do a blood test." They do the blood test, and then they say, "Right, ring back in a week and we'll discuss the findings." And they ring back in a week, and the receptionist says, "Yep, your tests are in and everything's okay." And so the patient says, "Well, okay, why do I feel like this?" And they say, "Okay, we're not really sure. Here's some Prozac." And the reason most people ring up and the blood tests are fine is because the ranges are extremely wide. And they were originally designed many, many years ago, where they took a cohort of people, I think it was around 300,000 of them at that time. And they and there were all sorts of people. So old, young, pregnant, sick, well, dying, the whole gambit. And they looked at it and said, okay, 95% of everyone's numbers are the normal range. And then 2.5% will be too high and 2.5% will be too low. And that's the range. And actually, looking back, it was a bit of a nonsense. So when you look at a doctor's range, some of the markers are extremely wide. Like a woman's estrogen will go from something like 300 to 1,200 or something. And yes, it matters what time of the month that blood test was taken, but there's a huge disparity in the numbers. And the same thing with vitamin D, same thing with a lot of the markers. And so we use what's called an optimal range. There's a lot of research showing that if you can get people in an optimal range, which is much narrower, they tend to be pretty much without any symptoms and without much illness. Whereas if someone's in the doctor's range, but it's outside the optimal, so in other words, it's higher than the optimal, we can tell if something is about to happen or has started to happen. And then we can get ahead of it very quickly. Mm-hmm. If you go to a doctor, they're not going to do anything until you're right out of range, which means your cholesterol's been high for a long period of time and it's already caused a lot of damage potentially. And they're only there now at the wrong end of it, trying to treat your established illness, whereas we're looking at preventing those illnesses. And I'll give you a good example of it. I've had more than one, at least 3 occasions this happened, where a male patient's come to me and they have what's called PSA, prostate specific antigen, which is the blood marker for the prostate health. Actually, it's not much use to anybody. It's a bit of a rubbish marker, but it's on most of the tests. And their PSA was optimal, absolutely perfect. But there was a couple of others. One's called creatinine and one's called monocytes. And the creatinine was elevated outside of the optimal range, but well within the doctor's range. And the monocytes were the same, just outside of optimal, but well within the doctor's range. And when we look at the complete test, because we look at an algorithm that looks at all the markers in combination, not just, oh, this is high, therefore, it looks at maybe 10, 15 markers in regard to a specific issue. And then the combination of those will give us a probability of dysfunction. So anyway, the guy, PSA is good, creatinine mildly elevated, monocytes elevated, but well within the doctor's range. And I said to him, okay, due to your age and some of the things this report is telling me, I want you to go to the GP and get a prostate examination done, just for housekeeping. Let's just make sure everything's okay, because he hadn't been for one for a while anyway. So he said, yeah, no problem. So he goes to the doctor and he says, can I get this exam? And the doctor says, look, you don't need this exam. I've seen your bloods are perfectly okay. And he says, yeah, but I'm here now. And this guy said this to me. I really kind of want to get it done. And the doctor was really adamant he didn't need it. But in the end, he said, okay, let's do it. And the examination is a digital rectal examination, finger up the bum to see and feel the prostate. And the doctor said, oh, actually, yeah, that doesn't feel too great. Let's just get it scanned. And they find there's two tumors, and one of them is stage 2 cancer. Now, that's the same blood test that they would look at the doctor and say, you're absolutely fine. And there'd be nothing done regarding that until some of his numbers were extremely high, or that was then stage 4. And then the conversation isn't, all right, we need to treat this. The conversation is, okay, have you got your affairs in order? And so using an optimal range is, and I've seen it for decades, is so superior to looking at the normal range, because you can get ahead of things before they happen. Cardiovascular disease, dementia, Alzheimer's, diabetes, cancer. You can see things happening and you know that you can start reversing them before anything takes hold. So that's why we use the optimal range. And the report is normally around 100 pages long. So when you get your 2 or 3 page report from your doctor next, think about what the difference is when someone brings you 100 pages and says, right, I've looked at this, I've studied it, and I know exactly what's going on. So we can start getting in and dealing with the pressing issues so that these don't become big problems. So bloods is the first one. And then I like to do a toxicity test, because heavy metals, mold specifically, and there's many of them, so we test a lot of them, chemical toxins and environmental toxins. I want to see what that load is on the body, because we will all have accumulated some over time, and they can be very destructive when it comes to things like brain health, cancer, diabetes, cardiovascular disease, just all the nasties. Once you've got all that information along with your historic data from your questionnaire, then you're in a really good place to say, okay, this is what your current health is. These are the areas that we really need to get in, address, and improve on. This piece of work is going to take us the first 4 months. This next one will take us the next 3 months. Then this one will take another 5 months or whatever it is. Then we will retest and see where they're at. And we'll also reassess symptoms and quality of life and how you're feeling and that kind of thing. So we are very, very comprehensive in our approach. We will look at everything. And sometimes people will work with us for 2 or 3 years. I've got patients that have worked with us for 3 years now, because they feel that it's just amazing for them. One of them I'm thinking about is a 74-year-old male who owns 5 restaurants. He still works, very thriving business, best shape he's ever been in, he says, feels amazing, can't believe how well he is, so on and so forth. And he wants to just keep working with us, because there's always something we can improve upon, or we can tweak. This is not someone who's ill and wants kind of to remedy things. This is someone who just wants to keep optimizing,
maintain,
and keep doing the next great thing for himself. So I mean, that's his choice. But so that's kind of where we're at with the testing and why we use optimal ranges.
With regard to testing and information, there's an endless amount of information a patient can receive now, especially through the testing, also through the internet. Yes. So Dr. Google is very prevalent for many people, can be the first place they go down. I work with cancer patients, and one of the first things that I do is tell people to be very careful. The questions that they ask will bring up the answers that are prompted. Where do you see that type of information fitting into someone's overall health plan?
Well, I mean, we've got worse now. We've got ChatGPT and Bard and all the other AIs that we've got. So here's the challenge, right? As humans, we're hardwired to problem solve. And when we're adults, we approach a problem by going to our experience and solving it in the same way we solved other things. So, for example, if your washing machine breaks down, you may look for a local plumber who will come and fix it, or you may go to YouTube and try and find a video where somebody has got the same sort of problem and they show you how to fix it. Then, yep, all you do is you open the back and you put out this pipe that's blocked, and then you unblock it, put it all back together again, and it will all work. And you go, all right, great, that's fine. And then they'll go and follow that instruction, and lo and behold, it works. And they go, oh, great, I just saved myself a lot of money with a plumber, and I fixed it myself, and I feel great. And and that's kind of how I did it. It was great. And people do the same for anything. Not so much nowadays when it comes to car maintenance, because engines are a little bit more difficult to get to. But certainly when I was a kid, you could take one apart and put it back together again pretty simply. But anything that they're trying to figure out, right? There's a lot of makeup tips on there. There's a lot of tips for anything. So when it comes to your health, why would you do anything different? You've got a health issue. You can't sleep. You're tired all the time, or your digestion's really bad. You're always bloated. You've got whatever the issue are. You're right. Let me just go online and see what the answer is. That's where the problem lies, because your washing machine has a finite amount of parts that will always be in the same place doing the same job, and therefore a manual will tell you exactly what's what, and by removing and replacing, you are then repairing the system. Doesn't work with your body. Your body doesn't have a finite amount of parts, and you are the only one of you in the world. There is no other one. So there's no way you will find the answer to your problem online. The information online can only be generic. It can only be for informational purposes only. It does not apply to you. If you are looking online for your information, look at it as, that's interesting. Okay, I learned something today. That's how energy is produced. Okay, fine. Do not apply it to your own health unless you are a practitioner with many years of experience, because the information has no relevance to you. They do not know your height, your weight, your age, your current liver markers, your cholesterol levels, your blood pressure, your glucose, your historic illnesses, your vaccine history, your food poisoning history. They don't know nothing about you. So it's no way it can be relevant to you. You also got polar opposite opinions online about the same thing. So, for example, many proponents of a carnivore diet, for example, will say that if you eat anything but meat, you will have no chance of removing any autoimmune disease. You will never have brain clarity. You will always be tired. Your digestion will never work. You have to go carnivore to solve all these issues. And if you ever eat a vegetable, then you are dicing with death and you will kill yourself. And here's all of the research that they feel they want to put in front of you. And here are the hundreds of people, thousands of people that have eaten this way for 20 years and are thriving and feel amazing. Look at these people. You need to be one of these. And then in the next video you watch, the person says, unless you're vegan, you've got no chance of being healthy. And if you eat meat, you will die. And here's all the people, here's all the research, here's all the proof, here's all the anecdotal evidence. And it's a very compelling argument, right? Because they've also got their book to sell or their product to promote or whatever it is. And then you've got paleo, or you've got pescatarian, or whatever it is. How does it relate to you though? Unless the person knows you intimately, in that he knows all of your details, all of your current situation, there's no way you can prescribe a suitable dietary approach. This is just nutrition we're talking about, never mind the other stuff, without knowing how it relates to you. Because if I personally chose to go carnivore and ate lots of high saturated fat meat products, it would do me no end of harm. I don't care what other people say. I don't care what results that other people have had, because my genetics do not like saturated fat. And if I eat saturated fat, it causes inflammation, it causes blood glucose dysregulation, it causes high amounts of cholesterol, it causes high liver enzymes, because that's my genetics. But I can go online and find some very compelling arguments to go ketogenic, right? And to use a high saturated fat approach. And so when you understand how nuanced it is, you almost want to stop looking online for answers. And all you want to do is look online for an experienced practitioner who can guide you through it properly. Because that will save you not only lots of frustration of trying things that don't work and then trying the next thing that doesn't work, the next thing, or buying the superfood supplement that you thought was going to be the cure for everything and so on, but you'll get specific advice on things that relate specifically to you. And one of the things that my business does is, and I came to this conclusion a few years ago, people want clarity that what they're doing for their health is the right thing for them. That's it, right? So people have these conversations in their heads all day long. What's the best diet for me? Do I need to take supplements? If I do, what supplements? And if I need supplements, how much do I need to take of them? And what's the best way for me to improve my sleep? Why is my energy so low? Why is my sex drive gone and I'm still only in my mid-30s or 40s? Why is it that I feel this every day? And people are looking for these answers and they're never going to find the real underlying reasons for them because there's too much conflicting information online. And so from a practitioner's perspective, we take that on board, we dissect everything, we look at you on a very, very minute, detailed level, so we know what's going to be best for you. And then we tell you what to do and how and why. And that brings you clarity that what you're doing for yourself is the right thing for you. And then we'll tell them, do not go and tell somebody else to do this. Because just because it worked for you does not mean that your friend down the road who's got a similar problem, it's going to work for them. And that's why looking online, I feel, needs to be looked upon as information only, but not implemented to try and fix your own health, because it's just not the way things are going to work for you.
Absolutely. And again, I work with cancer patients, and when cancer patients are looking online for information, it can take you down a deep, dark hole that you really shouldn't even be approaching. So great information, a great sort of way to summarize all what we've been talking about. And I think the internet piece is a good piece to sort of juxtapose the testing, because testing gives you markers. And if there's one thing that I've learned with working with people is they like to see the markers. They like to see the baseline, and they like to see it's a practical, physical. You can look at it and see that things are improving or not improving, and then you can make your adjustments. I think it's great. If people wanted to get in touch with you, Paul, find out more about what you do, where would they look for you?
The best thing is to go to the website, which is paulburgess.uk. And I'm sure you'll put a link in the show notes. That'd be wonderful. And then you can, take a look through the website, and also you can book a free call, which would be that 30-minute initial chat about anything you want to talk about from a health perspective. More than happy to hear what people's issues are and then try and guide them in the right direction. That is booked for 30 minutes, but it often takes a lot longer. And it's all free. So by all means, I'd love to speak to you. It'd be me that you speak to, not one of the team. And then from there, we can point you in the right direction, hopefully, or maybe suggest a test that you might want to look into, or we can at least give you some clarity on things. So that's the best place. And also from there, you can find Instagram, which I'm not very active on, to be honest, and any other social kind of bits that I do. But realistically, the website is the best place. And there's lots of other podcasts on there. There's a lot of the free download kind of stuff that you can download and get some information from there as well. So yeah, that'd be the best place. And if you mention Kathy and the podcast, it'd be great to know where you come from, and I can give feedback to Kathy and show that this is getting out to the right people, and we can all grow and get better from it.
Perfect. Now, you would work with people outside of the UK, Canada, United States?
Yeah, I've got patients currently I've got patients in Europe, Middle East, Asia, India, Africa, Australia, USA. Don't have anyone in Canada at the moment.
Well, hopefully we can change that for you.
But I'm always open. Like I said, I lived in Vancouver for quite a while. It was a beautiful, beautiful city. Wonderful. I keep asking myself why I came back to London. I'm yet to figure that one out. But yeah,
it's always open there for you. Probably a little bit more expensive than the last time you were there, though. Hard to buy a house.
Yeah, I looked, do you know what? It's interesting. A couple of years ago, I looked at what the kind of prices are from purchasing or renting or whatever it is. And they're basically the same as London. There's no
Really?
difference. Yeah, and it's not cheap.
No, it's not cheap at all. Thank you so much,
But
Paul, for joining us. I really
my
appreciate it.
pleasure.
Great conversation today. Everybody, we will talk to you next week on the Health Hub.
You have been listening to The Health Hub, hosted by Kathy Biasi, here on Radio Maria Canada.